Pharmacogenomics plays a significant role in individualizing antiplatelet therapy for cardiovascular diseases. By analyzing specific genetic markers, clinicians can identify patients who are more likely to respond to certain antiplatelet agents and those who may be at an increased risk of adverse events. Here's an overview of the impact of pharmacogenomics on individualized antiplatelet therapy. 1. Clopidogrel and CYP2C19 genotype. Clopidogrel is a commonly prescribed antiplatelet agent used in the management of acute coronary syndromes and after stent placement. The CYP2C19 gene encodes the enzyme responsible for converting clopidogrel into its active form. Genetic variations in CYP2C19 can result in reduced enzyme activity, leading to decreased effectiveness of clopidogrel. Pharmacogenomic testing for CYP2C19 genotype helps identify patients who are poor metabolizers of clopidogrel. Poor metabolizers have a higher risk of adverse cardiovascular events such as stent thrombosis or myocardial infarction. Based on the genotype, alternative antiplatelet agents such as prasugrel or ticagrelor may be recommended for patients with reduced clopidogrel metabolism. 1. Prasugrel and CYP2C19 genotype. Prasugrel is another antiplatelet agent used in the management of acute coronary syndromes and after stent placement. Similar to clopidogrel, prasugrel requires activation by CYP2C19. However, the impact of CYP2C19 genotype on prasugrel response is less pronounced than with clopidogrel. Genetic testing for CYP2C19 genotype may still be considered in cases where there is uncertainty about the optimal antiplatelet therapy. However, routine testing for CYP2C19 genotype is not typically required before initiating prasugrel. 3. Ticagrelor and genetic variants. Ticagrelor is an oral antiplatelet agent that does not require activation by CYP2C19. Genetic variations in other genes, such as ABCB1 and SLCO1B1, have been studied for their impact on ticagrelor response. Although genetic testing for ticagrelor response is not routinely recommended, ongoing research is investigating the potential role of these genetic variants in guiding ticagrelor therapy. 1. Genetic testing in dual antiplatelet therapy, DAPT. Dual antiplatelet therapy, DAPT, with aspirin and an additional antiplatelet agent such as clopidogrel, prasugrel, or ticagrelor is often prescribed following percutaneous coronary intervention or in the setting of acute coronary syndromes. Pharmacogenomic testing can help identify patients who are at increased risk of adverse events or treatment failure with specific antiplatelet agents. This information can guide the selection of the most appropriate antiplatelet therapy and individualized DAPT regimens. By incorporating pharmacogenomic testing into clinical practice, healthcare providers can personalize antiplatelet therapy for cardiovascular diseases, improving treatment outcomes and reducing the risk of adverse events. It allows for a more targeted approach to antiplatelet drug selection, ensuring that patients receive the most effective and safe treatment based on their genetic profile.